Nursing Through COVID, the Santa Cruz Journey, a collective story from the nurses of Santa Cruz County. Across the world, nursing encompasses autonomous and collaborative care of individuals of all ages, families and groups, communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and care of the ill, disabled, and dying.
Advocacy, promotion of a safe environment, research, participation in shaping health and health systems management, and education are also key nursing roles.
Nurses' exquisite skills of involvement opens up possibilities to notice important aspects of care, allowing nurses to see what patients need in ways that respect and attend to their concerns. Patricia Benner, Health Impact, 2021.
Nurses provide the vast majority of care in the United States.
If there was a day when nurses didn't show up to a hospital, you may as well close it. Dr. Frank Lavello, ER physician, Phoenix, Arizona.
As COVID struck, the nurses throughout Santa Cruz County stepped up to care for our community. The following shares their experiences in 2020 and 2021.
While some people wipe down their mail, we strip out of our clothes before walking into our homes. Our families are scared of us and what we face at work.
Every day I am off, I get called to come. Physically, it is exhausting, no breaks, no meals. I also have kids at home. ICU RN during COVID, Phoenix, Arizona.
We are trained on new processes daily. This risk of not mastering the constant new tasks is being infected with a life-threatening virus.
The COVID pandemic presented a steep learning curve for recognizing symptoms, charting expectations for the disease trajectories, and generating effective intervention. Nurses, physicians, and scientists learned as they went. Dr. Patricia Benner, Health Impact, March 2021.
Despite lack of knowledge about the new virus, is nurses' understanding of the centrality of care of the body and preserving personhood and social connections with the patient and their loved ones. Direct and comforting care of the body is at the front line of preserving life, personhood, and humanity. We figure out now to work outside in tents as well as in COVID ICUs. The focus is on the patient and families, not the character, courage, or skills of the nurse.
Nurses' critical diagnostic and urgent interventions are underrepresented in public media and social imagination. Patricia Benner, March 2021.
Nurses learned how to collect an adequate nasopharyngeal swab while minimizing their own exposure, how to communicate with a mask and a PAPR and stay connected to our patients, how to provide respiratory care in a parking lot. We start connecting, reaching out to one another, sharing everything we think might work to fight this crazy virus. We learn from nurses in Wuhan, in Italy, in New York. Nurses' commitment and skilled know-how enabled them to meet the challenges. Their skill of involvement with patients, families, and each other. Our town catches on fire. We plan to evacuate our hospitals. We go to work as our homes burn down. Our sickest patients have no visitors, no loved ones, no support but us. And we keep trying to connect with them as we yell over PAPRs and try to show patients our reassurance through our goggled eyes. Nurses stand in as surrogates for families, working to preserve life and shepherd death for patients and their families, highlighting the intimate and sometimes hidden role of a nurse.
I don't want someone to die alone. Sarah Reynolds, RN, ICU manager, Death Through Nurses' Eyes, New York Times, February 2021.
Home and work and life feel chaotic, and nurses have little chance to refill their cups. It is unfathomable that nurses went through all of this death. An ER nurse in our county shared her story of trauma and grief.
I was not trained as a hospice nurse. I was trained to save patients, not to stop CPR on a 27-year-old who came in with COVID.
Nurses in a Phoenix, Arizona ICU shared that they grieve every single death.
It is always on my mind. Are they going to make it through the night?
Many hide their trauma, leaving them isolated and alone. They don't want their families to know about the burden they carry. Those tents we work out of are filled with acrid smoke. It seems as though the whole country is on fire. Racial reckonings happen all over the country, and we challenge ourselves to provide care that closes disparities and chasms in equity, not just with COVID, but with everything. We pack evacuation bags. We watch our friends and family not take this all very seriously while we wonder if the county will have enough body bags and make contingency plans. Nurses were far more likely to die in the pandemic than any other healthcare worker. There were 1,152 reported deaths of RNs by COVID in the United States by April 2021, more than during World War I. The air is still full of smoke and COVID, and many of us remain evacuated from our homes. Glimmers of hope in dropping COVID infections, followed by devastating virus spikes as fall goes on. We reinvent student curriculums and clinicals, trying to teach nursing students everything they will need to prepare them to practice nursing in this new world. We mourn empty Thanksgiving tables while we watch others gather, and we are both envious and terrified of those tables. We head into homes where everyone has COVID, trying to keep them well enough to stay there. We find homes for the homeless who are ill and convert hotels into respite beds. There are days we think the whole system will fall apart. We are exhausted, working extra shifts nonstop, often in areas of nursing we just learned. Hospitals are full. There are not enough nurses or ICU beds, and somehow we keep going. Triaging, oxygenating, proning, coding, stabilizing. Over and over and over. And of course, people are still having babies and fighting cancer and getting GI bleeds and needing us to be there, to be ready, to be compassionate, to be reassuring. Our SNFs are devastated by COVID. Nurses and patients are getting sick and dying at uncontrollable rates, and the National Guard has to come support staffing. In the middle of December, we got our first vaccines and weep tears of relief as we vaccinate our colleagues. We think about how to vaccinate hundreds of people a day, even thousands, and we do it in gale force winds and atmospheric rivers. And the relief we see on our community's faces brings us joy and healing. And slowly, our hospitals empty. Our SNF outbreaks wither down. We juggle the politics of who gets a vaccine and how to get vaccine supply. In the face of politics, we use evidence and equity as our guides, and it makes a lot of people angry. We keep vaccinating, keep vaccinating, keep vaccinating. Our nursing students make this possible, bringing their hope and eagerness and passion to the work. We vaccinate in parking lots and school gyms and fields and fairgrounds. We are active participants in history, standing in solidarity and understanding of the challenges and human costs of caring practices that are essential to take care of critically ill patients. In this year, we nurses have carried the immense weight of COVID, carried the nursing charge to keep our community healthy, to prevent this disease taking over, to provide immense compassion and care to those fighting this disease, and to be everywhere the community needed us. The years 2020 and 2021 have been designated as the Year of the Nurse. This demonstrates a meaningful acknowledgement of the courage and significance of nurses in caring for COVID-19 patients and their families. To all nurses, a big thank you for your leadership, innovation, and excellence.
Hello, I am Suzanne Miyamoto, the CEO of the American Academy of Nursing. It is my honor to share a few words of hope and encouragement during yet another challenging time for our country and around the globe. Nurses are a commanding force. Regardless of the role that they hold, nurses are the linchpin for change. What nursing inherently represents and achieves is improving health, championing wellness, and protecting vulnerable populations. Because of this, we must never forget the power of our presence. Throughout the centuries of modern nursing, our science, our evidence, and our experiences have embedded in us one true prevailing lesson. We impact the human condition through human connection. Throughout 2020 and 2021, nurses have been the bedrock in all of our communities. We have demonstrated leadership, innovation, and excellence. I cannot thank everyone in our profession enough for their dedication to health. And thank you to all of the nurses in Santa Cruz County who are providing care during both this pandemic and the devastating CZU wildfires. Today, as COVID-19 and the Delta variant continue to impact our patients, your commitment to prevention and compassionate care is felt by your community. I know one nurse in Santa Cruz, and her name is Maritza Lara. Her passion for a healthier tomorrow makes her an incredible leader. And for that reason, I am thrilled she was selected for the Janine Rivet National Leadership Award, granted annually each year by the American Nurses Foundation and supported by the United Health Group. This award supports emerging nurse leaders to integrate their health experience into civic and professional opportunities. Leadership is a vision. Leadership is empowerment. Leadership is a moral compass. All of these traits Maritza holds. What inspires me and gives me the greatest hope is knowing that all nurses are leaders, because it is their voice that sparks change. It is the power of their presence that is felt by families and patients. Nurses are and will continue to shape the future of health and health.